everyone. I'm Meredith Fatsayas. My pronouns are she, her, hers, and I'm the Director of Mental Health for Denver Public Schools. I'm excited to share some important updates with you regarding the mental health services that we offer in our district. We are deeply committed to supporting the mental health and well-being of our students. We've been working tirelessly to enhance and expand our mental health resources, ensuring that everyone in our community has access to the support they need. Let me take you through some of the incredible services we have available. We have successfully implemented a universal mental health screening and developed guidance that is provided to school teams on how to use screening results to drive data-informed decisions across our schools in support of our students' social and emotional needs. This allows us to leverage the expertise and skills of our DPS mental health professionals, our school psychologists, and our school social workers in service of our students, allowing us to quickly utilize a tiered approach to identify schools and student needs and align services and resources to match those needs. Schools can adjust and make shifts to the universal and prevention work they are doing with social emotional skill building. They can identify students for targeted and intensive social, emotional, behavioral, and mental health interventions and resources, and respond to student safety needs that we may not have previously been made aware of. We have over 400 highly qualified and compassionate school social workers and school psychologists dedicated to providing individual and group therapeutic and social emotional services at all DPS schools. Whether it's dealing with academic stress, personal challenges, or any other mental health concerns, our team is here for our kids. In times of crisis, quick and effective intervention is crucial. We've implemented a robust crisis intervention program, ensuring that our students receive immediate support they need. Our district crisis recovery team is trained in PREPARE model, developed by the National Association of School Psychologists. PREPARE is an evidence-based model for prevention and response for school crisis. We are committed to being prepared to support in a variety of situations, with our emphasis being on school-based mental health response to a crisis. We prioritize prevention work to long-term recovery within the learning environment. We consult with schools to reduce negative trauma reactions, facilitate recovery, and minimize disruptions to learning. As we ensure meaningful follow-up and support for students with elevated scores on our Universal Mental Health Screener, the BESS, we have seen strong student outcomes. We're seeing trends between 60 and 65% reduction in symptomology indices on pre- and post-test measures for mental health services or specific interventions in schools. What this tells us is that when we are able to identify student needs and provide intervention, we are able to meaningfully support a student's mental wellness and positive learning outcomes. The building-based school psychologist and/or school social worker in your child's school is an incredible resource available at all schools. It is important to watch and listen for the following signs, which may indicate that your child may be having difficulty and could indicate signs of stress. Marked changes in unusual ways of behaving, including decline in school productivity or mood changes, changes in sleeping or eating problems, disorganized thinking or difficulty concentrating, withdrawing behaviors, easily distracted, physical symptoms such as a loss of appetite, stomach pain, headaches, acting out behavior including aggression, passivity or listlessness, tearfulness. There may be times you would like support with talking to your child about depression, anxiety, loss, or suicide. Please do not hesitate to reach out to the school or one of the community providers below. If you have any concerns about your child or another student in Denver Public Schools, please contact our mental health staff or use the resources above. Together, we can create a supportive and resilient community. Thank you for your time, and remember, help is always available.